Okay. There's other things I think I want to talk to you about. Oh, by the way, hi, it's Zippy. um, yeah, there's other things I want to talk to you guys about. Cause I'm sneaking up. Well, I've been out 2.5 years now, and I'm maintaining my weight pretty well at about 163. I really fluctuate, and it's a wide fluctuation, and it doesn't really matter now, when it's that time. Yeah, I'll put on a solid 7 pounds of water, you know, but I'm usually hanging right around 163. So if I pop to 164, 165, I don't really care because it's not weight. Weight, it's just water. And I'm just finding that's true of me. But um, when you weigh 300 pounds, which is what I weighed when I had my gastric bypass. I started, and after I lost my weight and got down to the 163 or so, I started buying clothes that were cute and things I would never have done before. Like, I bought belts, and I've been wearing belts, and that's like my big thing. I really love them. And trying to accessorize and just do some stuff that's a little bit more modern. When you're fat, you have to wear whatever they've got, because nothing fits right. I mean, nothing, really, nothing, you know. So just the idea that you have choices is so. To me. So my thing is, I so what I did is I bought this skirt and I wore it the other day, and it was right at the knee or a little bit higher, and I wore a little pair of black shoes, and I wore a pink tee, and I belted the tee, and I did a video walking across the floor with my shoes with this skirt on. Now, I really liked the way I looked in this skirt, but when I saw myself walking across the floor, I didn't like what I saw. You know, you would think I'd be very satisfied, but I'm not. And I still feel dumpy. I don't feel skinny. I feel like almost skinny. Not skinny, but you know what I'm talking about. There's always a discussion, especially in the Bariatric Bad Girls Club, which I go in just to see what's hanging, but, you know, I didn't lose weight for my health because I was just dealing with my health issues, you know what I'm saying? I lost weight because of the inconvenience. My knees were hurting, and I thought, before I know it, I'm going to end up in some kind of wheelchair thing. So that's why I decided on the surgery. But when it's all said and done, what I really, the reason I got the gastric bypass is because I felt like I was a very sexy bitch. I felt sexy on the inside and skinny on the inside, and no one was seeing it on the outside, and I didn't like it. I wanted the attention from the male gender. I wanted attention, and I wanted people to look at me because I was cute, not because I was fat. You know what I'm saying? I wanted the attention. I'm sorry. I'm an attention hog, and I felt like I deserved some of that, but here I am, and I thought I was looking kind of cute in these clothes, and there's just parts of me that I'm not real happy with, you know. I'm not happy with this at all. But it was okay looking at it, straightforward, coming on. But when I walked away from the camera, you could see the back of it. And it was a dimply, fat, dimply mess. A fat, dimply mess. And I looked at my legs. I love my legs. I think they're really kind of pretty. They're so different. But I looked from the back, and they're a fat, dimply mess. And again, I looked like I did when I was 300 pounds. And then when I take off my clothes and I'm looking at all the fat in my stomach, again, it's a horrible mess. Well, not a horrible mess. I went to see about plastic surgery because I was hoping that I could get my insurance company to pay for it. And he said, Martha, I love the surgeon. He says, Martha, he goes, you need a lower body lift. He says, you need something to lift your legs. You need something to lift your stomach and get rid of the extra fat. He says, you need something also to lift your ass. He says, you got an ass back there. And he did. He said, ass. He says, you got an ass. I said, yes. When I went to see him, I took all my clothes off. Well, not my panties and underwear, but, it was like, really, let me show you what you're dealing with, okay? And I took my clothes off, and what I have is really good to work with. I'm not a lumpy, bumpy mess. Some folks, they'll lose weight, and they lose it in such odd proportions. My body is very proportioned after the surgery. I've lost it in a very proportionate way. But when I look at my stomach and I lift my skin up and I look, my hips are very nice. I don't have big saddlebags. I don't know. I think I would look really, really good after surgery. And he says, you've got an ass. I said, yeah, how about that? Go figure. He says, a lot of people don't have, after this kind of surgery, they don't have an ass. And I said, really? He goes, yeah. He goes, they lose it. And I said, well, my thing was I had ass enough for 2 people, so now we're back down to the right one. We're back down to my original ass. And so, and then he says, you need to do a lower body lift. And then he says, and then what we'll do in the next round is we'll get you a boob job and get rid of them arms, and take away, I need some of the skin taken away because I've got side boobs, It's just a shame that I've come this far, and it's not that I've got body dysmorphia at all. I don't have body dysmorphia. I feel that I've come this far, and it's not a complete job yet. I don't have a complete work done. You know what I'm saying? It's like I'm halfway there. And I still am not really completely seeing the person that I think that I am. The other thing is that, what? What is the other thing, Martha? The other thing is Donnie. He's so freaking funny because I was talking to him about this skirt, I said, Donnie, when you looked at me in that skirt, did I look funny? He goes, no, you looked great. He says, I thought you looked great. You see, Donnie's like, how I look, honey? Fine. Let me poke your eyes out. What are you talking about? I look fine. Okay, I look great or I don't look great. Give me that answer, fine. And so I said, how did I look in the skirt? You looked fine. You looked good, And he says, Martha, you're 51. You're not 30. And I'm like, well, you son of a bitch. That's a hell of a thing to be saying to me. You know what? He also said, we're the only couple where I'm getting older and you're getting younger. Yeah, I know. I'm feeling younger. And, he's a very patient person, and he loves me, so he's willing to kind of wait me out until I feel old again, I guess. And that's not going to happen for a while. And I gotta tell you, I've kind of been thinking a little bit. I don't know how serious I am about cashing in my retirement, my 401k, and having this surgery done. I know it sounds stupid, but I don't have a guarantee of tomorrow. I think my mother's gonna have enough money that she's gonna leave me enough money that I'm not gonna have to worry about retirement money. Do you know what I'm saying? And I'd rather do something now that I really want to do than save it for a rainy day, for a what if day. You know what? What if I die tomorrow? Well, if I die tomorrow and I have the surgery and I die right after the surgery, oh well, them's the breaks. But what if I died right after the surgery and I didn't died and I never had the surgery? Do you know what I'm saying? I don't want to live my life on a what if. I really don't. I don't want to live my life on a what if. You know, and the other thing is that I have a friend who has a motorcycle, and I ride with him sometimes. I get on the back and ride with Mikey, and I just adore it. I adore it. You know, and I want to get a motorcycle. And Donnie's like, well, what if you get into an accident? Or what if? I don't want to live my life on what ifs. I posted in Facebook once that I don't want to be so afraid of dying that I forget to live. And I don't, you know. I just have to weigh out whether or not it's the best use of money. I don't know. It's probably not, but I don't know if it's okay to go ahead and spend it anyway. I just don't know, you know. Anyway, I don't know. I need to talk to Dr. Katzen, don't I? I wonder if he could get me insurance approval. Anyway, well, that's my story. I'm sticking to it. Ah. Anyway, okay, I'm done. I will see you later. Bye.